Good afternoon. Welcome to today's conversation, Community Resiliency in the Face of Burnout. My name is Rebecca Devlin, and I'm a Training and Development Specialist at Saunderley. Saunderley is the learning division of the Geneva Centre for Autism. We are a learning platform for educators and professionals seeking to gain education and training in autism and mental health. It's our goal and mission here at Saunderley to kind of pave the way for educators and professionals to ensure that they have the best possible experience in the classroom. It is my pleasure to introduce you to our guest speaker today, Dr. Chris Jenson. Dr. Chris Jenson is a graduate of the University of Notre Dame and Loyola Medical School. He completed his physician residency at Northwestern Memorial Hospital and launched into a career in emergency medicine and urgent care. During his time in the ER, Dr. Jenson developed a love for teaching medical students and residents. Now, this unexpected passion led to a life transition and an exciting career in public education. Dr. Jenson was awarded Kansas First Year Teacher of the Year and successfully completed a competitive science education fellowship with the CDC, so the Centers for Disease Control and Prevention. And he proudly serves as a senior health advisor for multiple clients. Over the past 5 years, Dr. Jenson has consulted with multiple school districts and businesses on complex health issues in education and has impacted many different areas, educational and mental health related. In his most recent book, Behind the Mask, a guide to supporting schools and students, I hope I'm saying this correctly, I have read the book, it is an excellent book. Dr. Jenson was awarded, or the book I should say, was awarded Amazon #1 bestseller and #1, I hope I say this correctly as well, #1 bestseller and #1 new release in the summer of 2021, which is just fantastic, impacting many educational and mental health related categories. So please join me in welcoming Dr. Jenson here today. It's an absolute privilege to have this conversation and have this opportunity to learn from Dr. Jenson. So welcome, Dr. Jenson.
Oh, thank you so much. And really the honor is mine. I have a deep admiration for Geneva Center for Autism as well as Saunderley, and really just appreciate the fact that we're engaging in conversation today that teachers need, that educators need, and caretakers need. It has been a very tough time, and other duties as assigned in many of these roles have multiplied by factors unimaginable. And so, yeah, I love the opportunity to have a casual chat.
Yeah, it's good. It's good to conversate. It is. And I know the Saunderley team and I have had multiple opportunities to collaborate with you in the past, wonderful opportunities. You're no stranger to Saunderley. And I think I'm personally thrilled to be here today to have this conversation with you. I love the work that you do. I know that you have a lot of really good passion projects that you're involved in. And I enjoyed your book, and it's a wonderful resource. So yeah, the same as an opportunity to have a wonderful conversation today about really important topics. But here's something that I know that the awareness of students' mental health is rising, and in order to help students, we understand educators, they need to help themselves. But here's something I wanted to distinguish before we kind of delve deep into today's conversation and topic is burnout. We hear the term used all the time, and I use it too. I have a rough day. I'm so burnt out. I had a long week. I feel burnt out. But can we start by kind of laying the foundation of understanding of what we mean by burnout, and is there any kind of things that we can look out for that might be key indicators that we are on the way to burnout?
Sure, absolutely. That's a great place to start. Burnout, like many other terms since 2020, is very prevalent in the media and everyday discussions. And we certainly all feel tired after the long haul we've had. In fact, when you talk to most educators, really the last year has been tougher than the pandemic pinned down in 2020, 21. And I think that's because this expected return to normal, a lot of people didn't feel ready for it. A lot of people didn't feel quote unquote normal. And while the virus was at a higher level, we were all told it's okay to not be okay. But a lot of people now feel that they're supposed to jump right back into life full steam. And some of us, for a multitude of reasons, aren't ready for that. And so that has made a challenging year. But to get to the heart of the matter, so burnout can be defined many ways. I think the most casual everyday use of it is, chronic workplace stress or chronic life stress that has been difficult to manage or maybe just not manageable at all. And if that's sustained for a long period of time, we really move from just feeling tired and overwhelmed to a state of burnout. Building on that and adding a little more science nerd perspective, from a medical standpoint, we look at a couple things that should be prevalent over a long duration of time. So exhaustion that's independent of sleep. And that's a really big time teller. If someone is averaging 8.5 hours of sleep a night, yet can barely make it to 4 o'clock in the day, that raises some red flags. We see, a cynical, detached perspective develop with important things in life. And, for all of us, our job is important. And so that's one of the first places where that cynical perspective may arise. And should you have it, it's part of the process. It's nothing about you as an individual, rather it's just the course of burnout. Detachment, if the job is what's causing the burnout, then trying to distance oneself from the source of that often leads to detachment and lack of engagement, which then can mess with your purpose and passion and often facilitates a low or depressed mood. And to no surprise, when you're exhausted, you're not at your best when it comes to creativity. You also sometimes are at your worst when it comes to managing emotions. And so we see folks that are easily angered. So that's what I would really define as burnout. And what's the magic time interval? I don't have one for you, but it's not just a hard day or a hard week, but rather, I think the best way to define it is when this becomes the majority of your days.
Okay. That's good. I'm glad that we had an opportunity to clarify that, because I know we're going to go a little bit deeper into, and it kind of leads to my next question, but just in terms of looking out for those red flags like tiredness, feeling a little bit cynical, detached, maybe not able to regulate your emotions as much as you typically would have in the past. They would all be kind of red flags that you might potentially be going towards burnout, as opposed to just feeling a little bit tired, or maybe at the end of the week kind of just blues kind of thing. But is there a recommended workflow for educators to avoid burnout? In your experience, I know that you have a lot of experience in both the medical field and the education field, and you've done a lot of research and have done a lot of consulting with different school districts and businesses. So in your experience, Dr. Jenson, is there a particular workflow process at all that educators could use to help avoid burnout?
Sure, great question. So one slight disclaimer, but just recognizing the obvious, every school situation is different, right? Every district, every province, every state is different. And then when you get down to the actual building, they tend to have their own personalities too. But if we were going to look at it from a large scale perspective in the US and Canada, I think one action item educators should strongly consider borrowing from healthcare is the concept of triage. Now, if you allow me some grace to dive into this, triage, when I think of it, and try to avoid the analogies from Grey's Anatomy and other spinoffs in the media, but when I think of actual triage, I think of workflow, which is not nearly as exciting as Grey's Anatomy portrays it. But it's a workflow process that, before we dive into the weeds and the details, that forces you to accept one fundamental fact, and that is, as a physician, a nurse, skilled caregiver in the healthcare field, you cannot be all things to all people in a finite amount of time. And specifically, a finite amount of time is the shift that you're working in the hospital, right?
Yeah.
That should sound very analogous to the school day. Students, as an educator or an administrator, it is just not possible for you to be all things to all kids in a finite amount of time.
Yeah, I agree. And that's a really important thing. I'm glad that you brought that up. Yeah, that's very interesting.
Yeah, and so that's the background of it. Now, in the medical field, there's been a very practical, logical approach to this. And if you've ever gone, excuse me, to an emergency department, you witness this firsthand. For example, if I walk into, the A&E or the emergency department and I have a sprained ankle, in terms of acuity, is my injury immediately life-threatening? No. Could it be life-threatening the next hour? No. Is it something that needs to be dealt with promptly, even though it's not life-threatening? Well, if we're not busy, sure. But if we're busy, no. And you see, as I'm whittling my way down this list of priorities, to no surprise, I find myself sitting there for quite some time with a sprained ankle to figure out if there is a broken bone or if it's just some tissue damage. You see the opposite if someone comes in acutely ill, whether it be by ambulance or walking in. Let's say I'm having chest pain, it looks like a heart attack. That's an imminent threat. I'm rushed in, even in the busiest of emergency departments, and I'm dealt with promptly. Why this model works is because those caregivers in the back that are actually in the emergency department, if there's a large quantity of patients and it's a busy day, which most ERs now fall into that demographic, they cannot see necessarily all the individuals in the waiting room in their shift, right? And so they're going to do what the universe demands of them, which is to prioritize the patients that are most life-threatening and work their way down. And sometimes on a particularly most difficult day, you might have a lot of life-threatening priorities simultaneously. Now, if you accept that model, allow me to transfer to education.
Okay.
So in a classroom where I spent 9 proud years teaching science, can I deal with every student concern between 7 a.m. and 3:30 p.m.? Probably not, which means I'm inherently overwhelmed, just like the medical model. But what should I do that day? Well, let's say there's potentially life-threatening or very powerful concerns, which can happen in a school too. Perhaps a student is making some statements that might be suicidal, might not. Perhaps a coworker has kind of fallen apart emotionally and understandably because they just found out they're getting a divorce. I'm going to direct my attention to those things, accepting the fact that I may not be as good or able or facile to address smaller things, such as setting up the perfect lab for tomorrow or grading those papers that have already been waiting 2 days. However, that's what my job demanded of me that particular day. Now, just like the medical system, if I have an easy shift in the classroom, that's the day that I look like a rock star teacher. I have time to grade my papers. I have time to set up the next activity. I have time to make that activity perfect. And I think teachers, at least I'm going to pick on myself when I was in the classroom, we want to do everything. It's all got to be checkbox completed before the next day, right? And what's interesting is
location.
Yes, absolutely. And what's interesting is the medical model. I can't imagine at the end of a busy shift where if I took care of very critical patients, albeit maybe I only did 10 instead of the normal 25, but I had the most critical patients. I can't imagine anyone being frustrated at me for doing a good job there. I can't imagine anyone saying, would you run copies for the medical students, and stay after? Or would you set up an airway activity even though you had the hardest patients today? And
that's
so
very true.
And so I don't mean to speak lightly about this, and there's no humor intended, but yes, I dabble in sarcasm a little to make a point that teachers, after some of their hardest days, what do? They stick around to complete all the other items.
And it's eating into their personal time at that point, right?
Yes, I would suggest it is. Because one of the main differences that I've seen in the world of healthcare and education, where both individuals work extremely hard, dedicated, and passionate, there is an accepted perspective in healthcare that if you had that terrible, challenging day, what you need to do at the end of your shift, because you did what triage demanded of you, you took the hardest of the hard, is to go home and heal. And I just see educators struggling with that. And I think, interestingly enough, it might be because of their perfectionist attitude, huge hearts, and desire to be all things to kids. And what I would suggest, because I know if you're that great teacher out there, what you're thinking is, but I have to perform at this level.
Yeah.
And I applaud you for that. But I would humbly suggest that the community that you teach in is better off to have you at, let's say, 90% of what you're capable of on some days and have you for 25 years than to lose you at 110% after 3 or 4.
That is such a good point. That is such a good point. I'm so glad that you said that. So just so I'm understanding correctly, so this principle of triage, and to me it's so interesting because I associate it with the emergency room, I associate it with urgent care, but the truth is you can use this triage workflow process in any environment, like the school setting, your classroom, your education setting. You identify some student that needs more support than you, or a colleague or a coworker, and you give yourself permission, because it is that permission to kind of pivot and put other lower ranking priorities, aside for a second while you focus on this. But I do have to ask you this question, Dr. Jenson, because I know from my own work experience and other educators I talk to, what do you do then? So you've said to yourself, I'm going to walk out of the classroom, I've had the worst day, but I didn't do all my things I needed to do today, and I'm not prepared for tomorrow, but tomorrow's going to come. Do you have any tips or tricks or anything that you would suggest from your experience or research that would help answer that question? Because I know that question will be asked.
Sure. So that is the most important question. And I'm glad you hit it head on. What do you do the next day, right? When you're ill prepared. And I would like to toss out some evidence and then I'll tie it into your answer. So let me sidestep for a second. In the United States and Canada, there's been a big emphasis on student mental health, right? And absolutely. not that staff have been lost in the background, but sometimes they are, for the focus on student health. And that emphasis on student mental health has been justified. The American Academy of Pediatrics would tell you that 1 out of 3 kids before graduation meets the criteria for generalized anxiety disorder. The CDC in the United States would tell you that metrics of depression rose 40% between 2009 and 2019. I could quote stats in Canada and I could keep going in the United States.
Yeah.
Why that matters to the question you just asked, there's nothing wrong with walking in the next day as an educator, whether you're at the kindergarten level or the senior high school level, and saying to the kids, having a moment of honesty and teaching life skills, because your lesson's not prepared. And let me give you that example. I'll pick on myself. There was a situation where I could not reveal everything to the students. It would not be professionally appropriate, nor was it a fair topic for them. But I walked in and I said to them, hey, what we were supposed to do today is this. What we're going to do today is this. It was an alternate plan that I scraped together before school. But before we do that plan, I want to talk to you about why I made this change. How do you prioritize stress in your life? What would you do? And I asked some prompting questions for the kids. Great. It's interesting to know that. I had a situation come up yesterday that derailed me from getting these plans ready for you today. And I want to talk about how I prioritized the needs and matters and how I made a decision for what would be best in this moment and accept the consequences of that impact. And to be honest, I don't know if I made the right choice. We're going to go over it. And we spent time talking about efficacy, pressure, the emotional drive to be all things at all times. Are we better off to power through, or are we better off in that moment to accept this is an infrequent event during the course of a school year? And if I take care of myself and then come in with transparency and talk to my kids about mental health the next day in an appropriate manner, is there value to that?
Yeah.
I still have kids to this day that while they don't remember the anatomy or the chemistry I taught them, remember, and I will get the occasional email. I've been blessed with about 20 now over the last couple of years. I still remember the day you weren't ready, the talk you had, and how you were honest about. Yeah, and it was the most gratifying moment.
I'm sure that was a moment that they recognized you were being very candid with them. And also, you pivoted in that moment, Dr. Jenson, and used it as a really great teaching opportunity for your students. And it's something you can't learn in a textbook, or I mean, maybe you can, but it's that in the moment, that reflection, that conversation, that dialogue, that honesty that you had with you and your students. It seems to have truly resonated to the point that they're sending you emails after the fact. So that speaks volumes.
It did. It was a wonderful moment, and it was probably the best lesson I could have provided. And if you're like me several years ago and you're saying, well, hold on, I have a pressure to teach these things. The curriculum is fast and furious. I have to get through the day, or I have a honors or AP course or what have you. I would tell you that's all still true, and I understand that. But the reality is, you having one of those nightmarish days during the course of your semester, I hope statistically they're 5 or less. And there's nothing wrong coming in the following day, especially in the face of youth mental health statistics, and spending part of your lesson or the entire hour, whatever you deem appropriate, and just focused on using yourself as a model in an age appropriate and professional conversation about how you fell prey to a situation, how you felt, the emotion you experienced, how you navigated it, how you solved the problem. There is no superintendent or parent in North America that would be upset that you took a moment to go heal and then come in and teach their child about how to problem solve through a difficult situation.
Yeah, I agree.
It's not going to happen often. Why not give yourself permission in the face of youth mental health statistics to do that?
Yeah, and it's also it's something that was a challenge, and you're almost flipping it into a win at that point, because here you had this challenge, you had to pivot, your schedule's changed, you're coming in the next day, you're using it as a teachable opportunity. And somebody had commented in the chats that you were being a good model for your students. And at the end of the day, we're all role models for the students and the kids that we support and we teach. So having that to the just giving yourself acknowledgement that you're being an excellent role model at that point, I think it's really, really good.
Yeah, and I appreciate that kind comment, whoever it was. And teachers are role models. I mean, regardless of the age of the child you work with or children you work with, they will say things to their teachers they never say to their parents. I have 2 girls of my own. I have seen this now from both sides. And, to pick up myself, I can talk about responsibility until I'm blue in the face with my girls, who I'm blessed are good kids. But when Mrs. Gammon gives a lesson on responsibility, it is forever etched in their brain, right?
Yeah.
And because I'm an evidence-driven nerd, I accept that title. I felt sheepish when I walked in the next day with a canned lesson plan that was not really science, but just purely mental health and adjusting. And I sat and thought about it and said, okay, if the Department of Education of the United States walked into my classroom today at the highest level, I would say I triage needs appropriately. I was honest about mental health, and I spoke to the self-esteem, efficacy, and life skills that you've been asking me to so desperately since 2015.
Absolutely. That's fantastic. I think that's powerful, really, really powerful. So my takeaway from this is the principle of triaging, what it is and how you can apply it in those more challenging situations. But the big thing is, when you do triage effectively, it allows the teacher or the educator to have a more effective workflow process in their classroom. And we're all aiming to be as effective as possible as we can. But this is what's sticking to me, is to rid yourself of that guilt. If it happens, and like you said, it's not going to happen every single day. If there's a day where you have to triage and you have to implement that workflow process, that you're not going to go away feeling guilty about it because you didn't get to do everything you wanted to do that day or prep for the next day. You have an opportunity to flip it into a win, in a sense, and use it as a teachable opportunity. You chose to teach self-esteem, self-efficacy, and life skills. So I think that's really, really valuable, Dr. Jenson. I think a lot of people here today would appreciate that.
Well, you gave that a beautiful summary, far better than I could have done. And yes, and I think the biggest thing is, the healthcare world is not perfect, but for a very long time, they have used the triage model for the patient's benefit and the provider's benefit.
Okay.
And there is no reason that can't be done in education as well. It takes practice, but the biggest thing, when I really like what you said, is it justifies your actions and rids yourself of the guilt. Teachers already carry so much compassion and empathy, but they can't do it all. And let science show you that.
Yeah, that's so true. And that kind of brings us to something else I wanted to talk about today, which was resilience. And we know educators, like any workforce I know, are so incredibly resilient. It's that individual resilience. Could we talk a little bit about, educator resilience, and does this workflow process at all increase resilience in your experience, Dr. Jenson?
Yeah, so great segue to that. I think one of the things, especially in recent years, that's been thrust upon anyone, whether they were a frontline worker or an educator or what have you, is, hey, we're all going to have to display some grit and some fortitude and power through this. And the interesting thing is, I think that's how educators tend to function pre-pandemic and certainly post. That was just kind of the model we all used. And if you think about it, in many ways, while there's province or state expectations of what to teach, where there may be additional district initiatives and things that you're supposed to comply with, those are non-negotiables. But in many ways, you are on a unique island in your classroom. Whether I have a group of kindergartners or middle school children, or whether I've got kids flying through every 45 minutes in high school. And so, not surprisingly, as I'm sitting in my four-walled room, I assume control, and you know, I don't know, I put energy into everything. And so, I'm running the copies, I'm making the lesson plans, I'm setting up the activities, I'm grading the papers, I'm dealing with the spilled Jello on the floor, whatever it is that life hands that classroom. And it's just the nature of that model. What I would like to suggest is, and we can talk about how to weave triage into this a little bit later, but just out of the gate, the concept of community resilience. So let me go back to healthcare and show you another example.
Okay.
Let's move outside the hospital to an outpatient practice.
Okay.
Let's say, Rebecca, that you, myself, and another individual run a clinic and we see patients. We could do all the same things in parallel. We could see our patients, we could check our own labs, we could follow up with phone calls on anyone who made calls from home, wondering about if they should be seen. We could chase down results. We could do procedures. We could do all those things, and you're in your office and I'm in mine and our third partner's in theirs, and we're doing all those things individually on an island. And that's very taxing, and it takes time, and it can wear you down. Or we could accept the idea of community resilience, where there are some jobs that are harder than others. So in the hard week, I'm seeing the sick patients and chasing down labs, which gives you and my other partner lighter weeks, right? Where maybe you are doing the scheduled visits, the well visits, you are working on the preventative vaccinations, you're doing the simpler stuff, and our partners got their jobs as well. And so we rotate. Now, do all the things for that clinic get done? Sure. We could do them in isolation, or we could rotate the jobs. And the idea of having a hard week followed by 2 easier ones before I come back to the hard week really sounds quite inviting, as opposed to feeling like I have to do all things for all my patients all the time.
Yeah.
And so this community coverage is something that, again, is very familiar in healthcare. Now, I would anticipate your next question is, how do you ever pull that off in school?
Yes,
And
the logistics of it. I want to know more, because I think this is very, very interesting. The minute you shifted from the individual to the community, I sat up straight because I wanted to listen. So please do go into detail.
Sure. Well, the first thing to say is that this works slightly different in terms of a K through 5 experience versus a secondary school experience. There are certain things that we all find to be challenging depending on the grade level we teach. So, it takes a lot of time to set up activities at the elementary level. I don't know if most high school teachers truly appreciate that. When my mom was a preschool teacher, it's not lost on me. So setting up activities. At the high school level, grading is far more intense. Labs and projects might be more, instead of for an hour, they might be ongoing for days. But the point is, we could select work items that could be shared. Mm-hmm. So I'm more comfortable with high school because that's where I taught. So let me talk about that background. So let's say on my science team, there are 4 science teachers, okay, for chemistry, biology, anatomy, what have you. And there's only 4 of us. I'm going to pick a smaller school setting. And so we could do all that work in parallel. We could set up our activities, our labs. We could do our own grading. We could run our own copies. We could, deal with students before and after school. And that's how most teachers operate.
Yeah.
Or we could say, okay, well, what's the hardest thing? Well, to be honest, I love my kids, but let's say at my particular school, the hardest thing is I plan to do things in the morning or the afternoon, and they're derailed because students, to no fault of their own, come in and want help. Help with this problem, help with this lab, help with this concept. Well, that should be your first priority. Mm-hmm. So we decide in our group of 4, hey, we're going to create 4 jobs and we'll rotate every week. Job 1, dealing with help before and after school. I suddenly become the person to help before and after school for all 4 classes. Is that going to be hard? Sure. Is it going to be more time that I was already spending doing all the jobs?
Mhm.
Probably not.
Yeah.
Right. And most kids have the same question. So I just become that busy classroom during that week. What's some lighter jobs? Maybe let's say an individual is responsible for creating absent work, makeup work, posting things on the teacher website. That's their job. They're free to do that because they don't have to help kids before and after school. I've already taken that load off of them.
Yeah.
Maybe the third and fourth person are responsible for setting up the labs and activities that week. We've already beta tested this concept in a small school setting, and now we're going to do it in a larger environment. And I expect the larger environment to be analogous to the initial findings. But you know what we found is even on the week that you have the hardest job, it's still less time invested before and after school than you trying to do everything by yourself.
Wow. Wow. That's great.
Oh, the teachers were thrilled.
Oh, well, of course, because, sorry, not to interrupt, I feel like something I hear all the time from teachers is this chronic feeling of not having enough time. If they just had more time to get work done. And when you feel like you don't have enough time in your day, it depletes you of your energy, or it can. I won't say it does for all people. It can deplete you of your energy. It can, it can dwindle your passion in a sense. You don't have enough time to accomplish everything. So here you are with a process that has been tried and tested. And I know you're continuing your research that has freed up time for a specific group of educators. So I can only imagine this was a very exciting finding for you guys.
It was. And so we need to repeat it to make sure the trends hold true. And so now I'm over caffeinated and excited about it, but just, some numbers, I'm picking 4 teachers from the initial small beta test during the course of a week. So 5 days before and after school out of contract time. The teachers were averaging about 222 minutes, right, to 4 tasks. They were helping students before and after school, activity setup and takedown, gathering materials and posting them to the website, as well as distributing those to kids who were on vacation or absent. And then we also had differentiated instruction, meaning that there was a teacher dedicated to here's some better resources for kids who might have exceptionalities or are visual learners or auditory learners and so forth. And over that course, I said those teachers average, about 220 to 230 minutes or so out of contract time doing all 4 of those things. Those teachers agreed the hardest job would be dealing with all the science kids before or after school. Mm-hmm. They didn't spend any more than they're already spending. They averaged about 203 minutes when they were doing that. Wow. So on their hardest week, they were working no harder than they're used to. Yeah. And on the other 3 weeks, they were averaging between 50 and 80 minutes a week, which was a massive reduction, giving them back free time.
Yeah. Wow. This is something I feel like a lot of people would be very interested in learning more about. And I'm interested to see as you guys continue to replicate it and see what the results are. But any workflow process that, gives you back time in your day is worth investigating further and exploring.
Sure. And I agree. And the model is inspired by what goes on in the healthcare setting and the kind of this community coverage. And so now, if possible, I'd like to weave in triage in this.
Yes, please do.
So during my expected workday, right, it was a blessing when people had those very challenging days, where you're dealing with the highest acuity situations in a school. Because even if they had the hardest community coverage job and they were going to take care of kids and their questions before or after school, mm-hmm. they knew they didn't have the burden of setting up the activity.
Yes.
They knew they didn't have the burden of Susie, bless her, great kid. I haven't dealt with this for 4 days. She needs a different way to learn this English assignment. No, I can send her to one of my co-teachers.
Yes.
And what the teachers found was they were more willing mm-hmm. to triage in their day as they should, because they knew they had community coverage at the end of the day.
Yes. Oh, I can see how it's all going full circle here. So I had asked you that question, well, what do I do if I don't get my things done? And we had a little bit of a backup plan there for the pivot. But here there's something in place where you're leaning on your community, your team. And I like how we said team, because we don't always consider, if you're a teacher, you're a part of a team. It's usually you, your classroom. But we're all working towards the same goal. All teachers and educators are there to teach. So you have your community, you have your team, you have a process in place that on those days where you did have to reprioritize and give all your energy to a student in need or a coworker or whatever the case may be, guess what? There is a safety net there where the other work is being done, and you can go home that evening and you can come back in the next day and know it's going to be okay. I think that's fantastic.
Well, thank you. And you summarized that again so very well. But to your point, there are some things that I wish we could change about the educational system. But if they do change, it'll take some time, income and benefits and things like that.
Yeah.
But what we can work on immediately, effective today, is not feeling trapped, not feeling exhausted with the job, feeling that work is distributed across a team that you trust. That team could be your grade level in elementary. That team could be your subject matter in high school. It could be whatever you think best fits your building. That's up to your discretion.
Yeah.
But having a team support system makes you feel like you're not going it alone.
Yeah.
And as you said so beautifully, adding in the evidential-based and justified concept of triage that has flourished in healthcare for so long,
Yeah.
doing that in the educational system, especially in the face of everyone needing conversation about efficacy, mental health, and life skills.
Yeah.
It almost takes some of the pressure off the plate for teachers to do all things
Absolutely.
and be perfect.
Absolutely. I think that's really, really valuable. Yeah, absolutely. That's really great. And I think it's very empowering in a way because like you said, there's so many things out of your control. Let's focus on what's in our control, and that community. Remembering there's a community there. Shift from the individual to the community. Lean into your team, to your supports, and use those things that are available to you to prevent that exhaustion, to prevent that feeling like you're defeated in a sense. I think for me, I hear that I feel empowered knowing that there is something within my control that I can do to change my day and my workflow process. So this principle of triaging and the community resilience, the community build, leaning into your community, I think is it's very empowering. And I think a lot of people, I think it's hopeful. That's how I see it. It's very hopeful.
Yeah, it's, and I think you said that well. It is. There's been so much asked of educators across North America. And I think the first thing is to, really show them that there's a way to regain some time, that it's okay to make appropriate choices and not try to accomplish all things in the day, that it's justified, that the model works. It's not experimental. We're pulling it from healthcare where we know it's been successful for decades. And giving teachers permission to do that. And, there's a lot of things we work on. My next book is action items, these two plus many others that educators can use to regain time and joy in their classroom.
Wow. Yes. That sounds really interesting. Yeah.
But it's a process that I appreciate that Sonderly is taking head on. And because it is the thing that I think is the elephant in the room. You can't just tell people, hey, the virus is gone, things will be better. When, yes, that made an absolute impact on our jobs and our lives, a profound one for some folks. But the workflow matters that teachers struggle with, I think should be where a lot of our energy in the future is directed, because those are things we can make an impact on. Go ahead. I'm sorry.
Oh, no, sorry. I was just going to say, I didn't mean to interrupt. I'm conscious of time, and I did have one question. This might be a fully loaded question, but if I was an educator right now, and, I'm very intrigued by this process, and I want to think about even just communicating it to my peers, or what would be a good place to start for an educator? And I know we only have 5 minutes left. So is there anything that you could do in terms of directing an educator today of what they could do to kind of get this off the ground or open the conversation or start the process at all?
Sure. Well, I think the first thing is walking up to your team who probably has a lot of similar emotion and thoughts that you do in your building, whether that team, again, is by grade level or subject matter or what have you, and saying, would you consider, or can we all accept the fact that we do a lot of things during the day what I would say in parallel, meaning that Chris does them, Rebecca loves them, teacher 3 does them. And some of these items could be shared. Now, they could be shared if your curriculum is similar, right? For those classes, but even like activity setup, can I set up a physics lab without teaching physics? Sure, just show me what the lab is like. There are things that we can agree upon could be shared and distributed. And I think the proposal really needs to be, would it be nice, answer me this question before we get into the details, would it be nice at the end of the day if you knew things were taken care of and you only had a fraction of it instead of the total pie chart?
And who wouldn't like that, right?
Right. And then it's a matter of negotiating how. And to be honest, some teams and groups are tighter than others. And you don't want to try or it's my opinion, sorry, not a fact, my opinion, you may not want to try and do this as a whole school right out of the gate. You might want to try it with your closest friends and your teams. And then by all means, after a month or two, if it appears to be working, share the model, share the details.
Yeah.
And if it becomes a school-wide thing, great. You have really helped the culture for the building that you work in. And I think what you'll find is you're not going to drop off the things that you need to deliver to students, the care, the prep, the passion, it's all still going to be there. But what you're going to gain is the ability to handle situations and not feel guilty about them, the ability to distribute workflow across a team. And that really comes down to your drive and initiative and how bad you want that. Yeah. One thing I learned as an educator myself, there can be top-down initiatives from the state or the province or the district office, and typically they're met with resistance.
Okay.
The beauty of this is it is for teachers, driven by teachers, customized by teachers, teacher.
So much incentive to get
Exactly.
That's fantastic. Dr. Jenson, this time has gone so fast. I feel like we could continue this conversation. We are kind of coming to an end. We're close to the 12:45 mark.
Sure.
Is there anything else you'd like to add in the last couple of minutes before we wrap up? Anything really important that you still feel like you need to share at all?
Well, I just, I appreciate the fact that Sonderly is taking on this issue of staff exhaustion. I think the biggest thing that I want to impart is that it is very common. There are a lot of folks in education that meet the clinical criteria for physiologic exhaustion as well as the everyday, definition. But I do think there's a way out. And, some people may honestly need to leave the field and people should do what's best for them. But I think there are a lot of people that can regain time, regain a sense of value, not feel so confined to do everything. And it's really taking charge of your workflow. This is different from self-care, if that wasn't evident. Playing the guitar at the end of the night or going to a gym has value. I believe in self-care. But those things don't change your job. They don't change your workflow or how you navigate a day.
Because it's still the same the next day. It's like it's a break mentally, you get to engage in that activity, but the next day you'll go straight back into the same workflow, the same challenges and so on.
Exactly. And so whether you engage in these two examples of triage and community resilience, as I like to call it, or you come up with your own operational change, what I would encourage you to do is the problem is exhaustion. The causes of that exhaustion are many things, but I think it's safe to attribute some of those many things to other duties as assigned expanding, demand in the job place expanding, number of students in the classroom expanding. I can go on and on. Your operational changes, like the two we suggested, need to negate, mitigate, or in a perfect world, eliminate those causes of exhaustion. You will not be able to tackle them all, but you will be able to tackle some. And that is a wonderful way to start.
Absolutely. I agree. It's very empowering. It's wonderful. And like you said, anything that can negate or mitigate, why not explore it and implement it if possible in your own day-to-day workflow process. Dr. Jenson, this has been a fantastic conversation and I can't thank you enough. And I do hope we get to continue our conversations with you. I think that anyone that was listening here today has had received a lot of information, a lot of food for thought, a lot of really good things that are within their scope that they can implement in the classroom. So yeah, thank you on behalf of Sandra Lee and all of our participants and registrants, as I should say, here today. We are very, very grateful. Thank you.
Well, I appreciate the opportunity, and the pleasure is all mine. And yeah, anything we can collectively do for teachers, I think is time well spent.
And we agree. Absolutely. Thank you.
You bet. Take care.
Bye-bye.